More than 70 cases of a new coronavirus variant have been discovered in the UK. Officials say the strain, first detected in India, is under investigation rather than a variant of concern like the Brazil or South Africa mutations. The majority of the infections are in England, while a small number were found in Scotland. Well, joining me now from Edinburgh is Professor Linda Bald. She's Chair of Public Health at the University of Edinburgh's Usher Institute. Thank you so much for talking to us. So, a variant under investigation, when does it move to a variant of concern, and what determines that move?
Well, this is the B1617. We actually don't know as much about it, Kimberly, as we would like to. In Maharashtra, which is a state of India that's been badly affected, has the highest number of cases of any Indian states at the moment. The latest sequencing suggests it accounts for about 61% of their cases. It seems to have two mutations to the spike protein, and there's concerns that it may evade part of the body's immune response, but we don't know that. So what happens when it becomes more on the alert list? It means that we need more information, both from scientists in India, and also we'll have scientists here in the UK looking very closely at those 77 cases. So it's early days, but I think as we've learned throughout this pandemic, where you have countries or settings where you have a large number of cases, high incidence and prevalence of the disease, gives these mutations, variations, an opportunity to develop. And that's why we really want to keep an eye on this and try and not have more of these in the UK.
When was it first identified in India?
In March. So sequencing, and there is sequencing capacity in India. So it's been identified for a while now. But I think what's happened, as with the Kent variant, if you remember, the Kent variant was actually identified first in September. And it wasn't really until November, was it, that we started to hear more about it in December, when the alert was really raised because those cases were rising in Kent despite restrictions being in place. Similar things happening in India now. We're seeing that the surge in cases, particularly in some states, is so significant. They had over 200,000 cases yesterday in India, and young people in hospital. So we've known about it for a while, our colleagues there have, but it's really the effect that we're now beginning to see that's causing real worry.
The death rate is also up. Sunday, 839 deaths in India. They haven't had a very high death rate if you look at the population in total. But do they think that this new variant is playing into that death rate as well?
They think so. So just to emphasize, there's no evidence yet that this is causing more disease severity. But if it's more transmissible, as we've seen with the other variants, then you are going to impact the number of people who go into hospital and mortality. So I was speaking to a colleague in India this morning. They are incredibly concerned about the age profile of some of the patients they're seeing in hospital. And in some of the states, the capacity, particularly for ventilation, is really being challenged at the moment. So it's just the sheer volume. So more transmissible variants mean more people become unwell, and that really challenges the healthcare system. And I think it's just a reminder to everybody in the UK that globally, this pandemic is actually accelerating in some countries while we're here easing restrictions. So very much a cautionary tale, as I said.
And yet we have 77 cases here that we know of. I mean, how concerned should we be that we are easing restrictions here and we're getting new variants in?
I think it is a reminder to us of a fragile situation, and the surge testing in London for the B1351, the South African variant, again, I'm hoping that, that will not lead to many more cases and even local restrictions having to be applied. That's a scenario we want to avoid. But as we open up, as everybody has been saying on your program and others, we have to keep an eye on what's happening internationally and have a grown-up conversation about our borders and international travel. Now, unless something's changed in the last few hours, India, unlike Bangladesh and Pakistan, is not on the red list. I think there are real questions about that. We don't want any countries to be on that list, but it is about protecting the progress, actually, that we've made.
Do you think that's the only way to actually stop a variant from spreading in the country, is that if everyone who comes in from a country where we know that that variant is prevalent has to go into a hotel where we can monitor what they're doing?
It's a key part of the response. I know this is deeply unpopular, But it is what has been tried and tested in Australia, New Zealand, Southeast Asian countries is managed quarantine. We do need to apply that. Also, we just need two other things, briefly, Kimberly. We need the sequencing, which we have in the UK, and we're now able to sequence many more of the proportion of cases because cases are less. And we need the support for self-isolation if people are identified with any variants in the community. And there are still questions around that. But yes, managed quarantine, I think, for some countries is something we are going to have to continue to really have in the UK to get on top of this issue.
Briefly, should India be put on the red list, and should it be put on immediately without some sort of a lead-in time?
Well, I'm not making any of the policy decisions, and I try and stick to the science and underline what we know. But in terms of an effective intervention that might make a difference, managed quarantine and restricting travel, hopefully temporarily, is, as I say, a tried and tested approach used in other countries.
Professor Ball, thank you so much.